Sebelum lanjut menonton video ini, yuk tekan tombol subscribe dan nyalakan lonceng notifikasinya agar kami lebih semangat untuk memberikan video-video menarik lainnya buat kamu.
So with stomach cancers, we know that there are two main types, the intestinal and the diffuse stomach cancers. The intestinal type is due or caused by an inflammatory process which starts from gastritis, then progresses on to a little bit more serious kind of gastritis, and finally when this inflammation results in changes in the inner lining of our stomach. And this is a type of cancers that are very common in elderly men. There is the diffuse type, which are more common in women and also in younger patients, but they do tend to have a worse outcome, meaning that patients usually come and see the doctor only when the disease is very advanced. And that's the diffuse type. But both types are still considered adenocarcinoma, and this is a term that you may not have seen before, but it really just means a type of cancer, a common type of cancer. So stomach cancers are mostly found, a third of them are found in the gastric cardia, which is, if you remember, the first part of the stomach, like in this first picture on the left. Then another third are found in the antrum, or the lower part of the stomach. And then the rest are found in different parts of the stomach, with the highest number being in the body of the stomach. The risk factors associated with stomach cancers. So a risk factor is anything which increases your chance of getting a disease. But if you do have that risk factor, it doesn't mean that you definitely get the disease. And if you don't have a risk factor, it doesn't mean that you will not get the disease. But sometimes what we're trying to understand is that it increases your chance of getting the disease. So for stomach cancers, we know that a bacteria called H. pylori, or Helicobacter pylori, is associated very strongly with stomach cancers. And so, because of the realization of this, and then subsequent detection and then treatment of this infection, the number of stomach cancers has been coming down. Another kind of autoimmune condition called pernicious anemia, but this is a rare condition. Other risk factors would be things like obesity. What you eat. If you have a diet that is very high in red meats and processed foods, that has been shown to also be associated with stomach cancers. And lifestyle habits like smoking, alcohol, and of course, if you have a very strong family history with a first-degree relative that has stomach cancers, that is also a risk factor. Like this. Well, I think in the early stage, a lot of times, the patients may not have symptoms. However, that's the reason why a lot of patients with stomach cancers do present at the late stages. But patients may come to see us with symptoms of bloatedness, or just a feeling of very swollen tummy. They may have tummy pain. They may also complain of loss of weight, loss of appetite, not feeling like they want to eat, or something we call early satiety. So early satiety means that when you eat just a little bit of food, you feel full already. And that's because, if you remember the picture of the stomach, if there is a growth there and it causes a little bit of blockage, and so when the food enters your stomach, you already feel like your stomach is very full. so you don't feel like eating anymore. And that can then result in loss of weight as well. Patients can also complain of nausea as well as vomiting. And if they do have a tumor and it bleeds, it can result in blood being passed in the motion, or what we call melena or black stools. And if the blood loss is significant, they will then result in something called anemia or low level of hemoglobin or red blood cell count.
Terima kasih telah menonton video ini. Jangan lupa subscribe channel Take On TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.